Do you feel that dispensary managers and GPs within dispensing practices are looking for a different service sometimes from that of the normal representative who comes through the door?
Yes, I think that dispensing doctors certainly have always respected and worked better with the pharmaceutical companies where the reps really understand what dispensing doctor dispensing is. They need to understand the differences between dispensing doctor dispensing and retail pharmacy. A dispensing doctor practice isn't a practice with a pharmacy on site. Very often there isn't a pharmacist on site. The dispensing is carried out by the dispensary staff. And one key thing to understand from a pharma point of view is dispensing doctors get clawed back on everything they dispense. So you cannot treat a dispensing doctor dispensary the same way as you can a retail pharmacy. They're completely separate items.
So the clawback can significantly reduce the income to a dispensary, but at the same time, that is another reason why pharmaceutical companies should be generous in the discount scheme for the dispensed segment of their patient population.
Absolutely. For the items, for the patients who are dispensed to by the dispensary, because there's a clawback on every item dispensed, the pharmaceutical company needs to recognise that and give a discount in excess of the clawback that's currently available. That is a total discount which is greater than 11.18%. Discounts they've given fund rural healthcare. There's many branch surgeries that I've visited over the years where it wouldn't be financially viable to keep that branch surgery open, and it might mean that a hamlet with a population of 500 or 600 patients would have to all travel to their local dispensing doctor practice, which might be 4 or 5 miles away. So the discounting scheme certainly helps to protect rural healthcare. Without it, many dispensing doctor practices would have to give up some of those branch practices.
Do you also think that dispensary managers and dispensing practice GPs are looking for the holistic picture? They're not just looking for a percentage discount on a product. They actually want to understand the greater implications for the patients in the practice and for the practice overall.
Yeah, they're definitely. Just going in and giving a discount on its own, if you want to be serious, is just not going to work. You may get sign up, but you won't necessarily get pull through on sales. The pharma companies that do the best are the ones that give full support. So for example, one thing that dispensing doctors want, they like discount on medicines. That's essential to them to keep going. They like training, advice and support. They like it if the pharma company can really understand them, engage with them and give them as much help as possible. Specialist help, not just normal off-the-shelf help, but help with how to manage their dispensaries. And if the pharma company doesn't necessarily have the answers, they need to be able to refer the dispensing doctor practice staff to people who really know what they're talking about. I really believe they want understanding and they want support. They want the pharma companies to recognise that they need to make a profit on their dispensing in order to pay for the excessive costs of providing rural healthcare.